everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as cholestyramine. Its brand name is Prevalite. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So cholestyramine binds to bile acids in the intestines, preventing their reabsorption. It produces an insoluble complex which is excreted in the feces. In terms of indications for use, cholestyramine is indicated to be used as an adjunct in the treatment of hypercholesterolemia, and it can also be used to treat pruritus of the skin or itchiness of the skin associated with a biliary obstruction. Now, before somebody was to use cholestyramine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used by patients who have a complete biliary obstruction, and patients with a hypersensitivity to cholestyramine or any other component of the product would not be able to use this medication. Now, in terms of precautions, in chronic use, there may be an increased risk of bleeding due to vitamin K deficiency. Because of this, sometimes vitamin K supplementation may be necessary. Again, with chronic use, there may be a reduction in serum or red cell folate, so sometimes folic acid supplementation may be necessary. Pre-existing constipation may worsen and increase the risk of fecal impaction. Dose adjustments may be necessary in patients who have pre-existing constipation. Drug-induced constipation may aggravate symptomatic coronary artery disease. Hyperchloremic acidosis may occur with the use of cholestyramine, especially in small or young patients. And lastly, this medication should be used cautiously in patients who have renal insufficiency. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use cholestyramine, they can expect to receive their dose orally. If somebody is using cholestyramine to treat hypercholesterolemia, they would typically start off with a dose of about 4 grams taken once or twice daily. Maintenance dose would be between 8 and 16 grams daily given in divided doses. And the maximum dose would be 24 milligrams in one day. If somebody is using this medication to treat pruritus of the skin, they would typically use a similar dosing, which would be 4 grams once or twice daily initially, followed by 8 to 16 grams given in divided doses, and then a max dose of 24 grams. As with all medications, there are some side effects or adverse reactions that patients may experience while using cholestyramine, so I'll go over some of those here now. Some patients find that they experience abdominal discomfort while using cholestyramine. Some patients experience constipation or flatulence. And some patients may also experience nausea or vomiting. That's all we're going to talk about today with cholestyramine. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.